Alrighty, now I got my camera situated. First thing I'm going to do is verify the physician's orders and review the client's history for any conditions that would impair catheterization. I'm going to assess the pertinent lab results and check for allergies. We're then going to assess the client's weight, age, level of consciousness, ability to cooperate, and mobility of their lower extremities. If needed, I'm going to delegate assistance with positioning the client and gather all of our necessary equipment, like our catheter tray and our washcloth. I'm going to take the supplies into the room and provide patient privacy. I'm going to introduce myself, perform hand hygiene, and identify the client using 2 patient identifiers like their name and date of birth. And I'm going to explain what I'm going to be doing today. I'm going to apply clean gloves and position the patient. For a male patient that I have today, they're going to lie supine with their legs extended and their thighs slightly abducted. Next, I'm going to drape the client so that only the genitalia is exposed. And I'm going to clean the perineal area with soap and water, grabbing the patient with my non-dominant hand. And then I'm going to get a new washcloth, rinse the area, and then I'm going to allow that to dry. I'm going to remove my gloves and perform hand hygiene. Now I'm going to place the catheterization kit on a clean surface and open the wrapper using sterile technique. I'm going to grab my sterile gloves. Papers are not cooperating. I'm going to put on these sterile gloves eventually, because it is very important to maintain sterility throughout this entire procedure. I'm going to put that off to the side. And I'm now going to look at my equipment, and I want to maintain the integrity of my equipment. I'm also going to now apply a sterile drape to the patient, making sure I only leave the genitalia exposed. I'm going to, now I have this saline, or I have my catheter. I'm going to apply this saline to the tubing. Here we go, just so I have that ready. I'm going to open my alcohol swabs, and I'm going to place them all in my tray. Dispose it up. And I'm going to open up my lubricating jelly and put that in the tray as well. Now I'm going to clean the urethral meatus with an antiseptic with my antiseptic swabs in a circular motion. Allow that to dry, and then I'm going to grab the catheter, roll the catheter in the lubricating jelly, and I'm going to be inserting this 7 to 9 inches inside the male through the shaft of the penis. I'm going to grab the shaft with my non-dominant hand, and I'm going to alert the patient that I'm going to be inserting, and then I'm going to insert 7 to 9 inches, and I should tell them also during this to breathe for comfort if they need to. I'm going to keep going until I have met resistance, which I have met resistance. I'm now going to hold the catheter in place with my non-dominant hand, and I'm going to fill the balloon with my pre-filled syringe according to hospital procedure. And then after inflating the catheter balloon, I'm going to pull on the catheter a little bit until I have some resistance. And then I'm going to remove my gloves. Perform hand hygiene. And then put on clean gloves. I'm now going to remove the sterile drape. And then I'm going to secure the catheter onto the patient's inner thigh with the hypoallergenic tape. So let's imagine this is the patient's inner thigh. Feels right. And then I made sure when I was taping it to the inner thigh, I was making sure that the catheter bag is going to be, the drainage bag is below the bladder so that it can have free gravity flow. And I would hook it onto the bed frame and not the side rails. I'm going to cleanse and dry the perineal area. And I'm going to re-drape the patient. And then I'm going to remove all of my equipment. Not this. And then I'm gonna place that into the appropriate trash can. And then I'm going to remove my gloves and perform hand hygiene. And then I perform hand hygiene. And I'm going to observe the urine in the catheter bag for the amount, the color, and the clarity inside the bag. I'm going to assist my patient into a comfortable position, raise their side rails up ×2, and lower the bed to its lowest position. I'm going to place a call light next to them, and then I'm going to document the procedure and the outcomes. And that's it.